Hello everyone. Today I am going to speak about teeth grinding in children. What is teeth grinding? So this is a habit or a behavior in a child who in deep sleep can grind teeth. Sometimes this can be very noisy, waking up the parents who are sleeping next to the child. This problem usually is seen between 2 to 6 years of age in children. Generally, this is not harmful and most times resolves on its own. So, what are the causes? One of the cause dentists attribute is to malalignment of teeth, which means the upper set of teeth and the lower set of teeth, when we close the mouth, are not in perfect alignment. They are either front or back, and this could lead to grinding of teeth at night. The other reason could be pain in the ear or in the tooth due to a new tooth eruption, can also lead to grinding of teeth. Other causes could be stress due to a fight between them and their siblings in the day, or some scoldings they have received from parents for not complying with some of the activities the parents have told. And sometimes hyperactive children do exhibit grinding of teeth. So should parents be concerned? The answer is no, because most times this goes away on its own. So what are parents supposed to do? I think parents should wait a couple of days. If it is spontaneously resolving, they need not do anything. However, night after night, if they see this, they should visit a dentist and probably a pediatrician to ensure the ears, the teeth, everything is in place. They also should ensure that they are not scolding their child for any bad behavior. They should try and sit with the child on a one-to-one conversation and try to tell them what is correct and what is not. Instead of scolding, being firm is a better way to get the child to comply, and all good behavior should be praised later on. This itself improves the parent-child relationship, and maybe this teeth grinding may go away. The one more thing which could be done is post dinner, parents can give a warm bath to the child, then in comfortable clothing can tell some bedtime stories and engage the child in some discussions for 30 to 40 minutes before the child goes to sleep. Again, this activities certainly has a calming nature in children, and surely you will see that the teeth grinding resolves spontaneously. Thank you.